Hey there, listeners, and welcome to season 2 of Project Zero. The goal is the same as last year. We're going to hear the journeys of some of the best project leaders in the game. But this season, though, we're going to spend a little bit more time talking about AI and the impact it's having on the industry. My name is Alex Tuck, and I'm the host. I am here with healthcare project manager Jordyn Seri. Welcome to the podcast, Jordyn.
Thank you, Alex. Excited to be here.
Yeah, I can't wait to hear about your Project Zero. Why don't you start us off, Jordyn? Tell us a little bit about yourself and the work that you do.
Sure. Well, I've been a product manager by title for the last 5 or 6 years now, but I've been in healthcare for about 8 at this point. And if you told me that I'd be a product manager working as a 1099 contractor with clients like health tech startups when I was in college, I would never have believed you, but I didn't know then what I know now. So that's how it goes. And the path that got me here after graduating from Brandeis started from knowing that I wanted to work with underserved populations from a healthcare lens. So that's the thread that has guided my career decisions. But across my career, I've been patient-facing, providing care coordination and working with providers at a nonprofit under a Medicaid program. I've worked at that same organization as a project manager for the same Medicaid case management program. And then I moved to the health plan level of that program, managing the network of the 20 organizations providing services with the health plan's 8 ACOs and NCO. So you can see we're expanding reach here each step of the way, now at this larger systems level. But now I'm working as a contractor, and my main client is a health tech startup where my project stakeholders are pharma companies, clinical researchers, clinicians. So I've been able to see healthcare and project management from a lot of different levels and angles. So I'm able to bring a multifaceted perspective to how project implementations impacts all those different levels and all the different people at those levels.
That's so awesome, Jordyn. We haven't had a lot of healthcare PMs on the show yet. There's a lot in the pipeline here, and I'm really excited to hear your story. Most people don't understand how complex. You say healthcare, right? And people are like, okay, they think about providers, right? They think about the doctor, maybe the hospital, things like that. But there's like the plans and the pharmacy and the special pharmacy and like all like and the health tech and the med tech and all the different stuff that goes into it. And it's really neat that I think you having the perspective of touching a lot of these different groups, including the plans themselves, the payers, like that's very, very interesting. I'm excited to hear your perspective on all this. Cool. Let's get started. How did you end up in project management? You talked about how the past few years you've technically had the title of project management. You've probably been doing project management way longer than that. But when did you make that transition to an official project manager?
Yeah, well, I'd say it started happening to me. I didn't know what project management was before I actually had the title. So one of my first roles was as a data analyst for a healthcare consulting company where I was managing our projects, but that wasn't my main role. And then after that, because I wanted to move more towards that direction of supporting underserved populations, I moved into my care coordinator position. So I was managing about 40 Medicaid patients where tracking deadlines that were tied to payments and quality scores was done through multiple systems, including whatever system worked for you as an individual. So for me, that system was Excel. And so I taught myself some beginner and intermediate skills like conditional formatting and date formulas to bring my attention to when a deadline was coming up. I got to start thinking about this. And that turned into this dashboard. So I was making sure that no patients were falling through the cracks. And coworkers started asking me about that system, and I taught them how to create these dashboards, ones that work for them based on what their preferences are. And I kind of became that go-to resource to help people more efficiently track their work and what you may call working smarter, not harder. That's really what motivated me. So when a position opened up for a project manager role in the department, that had to be filled urgently, and I was flagged as someone who could be a good fit. And I think it's because they saw that initiative I had taken to keep things organized and structured. And so I had no idea what project management was at that point, but the job description sounded interesting. So I accepted the promotion and figured it out from there.
That's awesome. Yeah, and you could have just sold your spreadsheet for a ton of money because, like, people pay so much money for care
On
coordination
Etsy.
software, and it's not even like, the software out there is not even good. But that's awesome. I love that you got your feet wet in care coordination because that is the ultimate PM role, right? Like, and it's, in my opinion, out of all the different roles within the healthcare space, it's the least appreciated and most important role, especially with mental health care coordination. Oh my God. If that doesn't happen, like, you just have so many issues, like information not being shared, et cetera.
Yeah,
The-
that work is
Yeah.
critical to patient
Yeah.
care. You really directly impact people's lives in that role. So it's so important that you're on top of, you're filling out applications, you have appointments that you need to attend with your patients, whether they're medical or for applying for benefits or whatnot, housing. You have to be on top of this. So,
Yeah. Yeah, exactly. But take me one step further back. Like, what were you doing before you even got into the care coordination, before you got into project management?
before that, I was pretty much in college. So I don't know how
Okay, fair
much
enough.
there is to talk
Yeah,
about
what
there.
did you
I mean,
study? What did you study when you were in college?
sure. I double majored in psychology and public health, minored in Hispanic studies. So I did do a fellowship my senior year. So the project was to improve public health education in the town that my school is in within the public schools. And so I organized the venue, the budget, catering, and we screened a movie called Bending the Arc. It's about Partners in Health, a Boston organization that's also global. And we screened that movie for anyone who was from Waltham. And then there was a career panel afterwards where public health professionals answered questions for the audience and then also let them know about opportunities. And so a lot of these people were students who'd never heard of this before. And so, broadening their minds about what's out there in public health was the goal. And so,
That's so
yeah,
cool.
I was the project manager and everything else. Sure.
That's so
Yeah.
cool. That's such a neat objective there. Yeah, Partners in Health is an amazing organization. That's so neat that you got to work with them. When you were a kid, did you gravitate towards being the most organized person in your family, or was that something that you developed as a professional?
Oh, yeah. I was definitely the organized one, the one trying to get us places on time, tell my parents that things are starting earlier than they actually are. And then, yeah, now in my personal life, I'm the spreadsheet friend. Like if we're going on a weekend trip, I have the packing list, the activities, who's cooking what meals and cleaning up. So that way it's all, taken care of and we just have a good time.
That's so funny. It's definitely a forced habit for me. Like, I am not naturally like one that I like not having structure because I like to shoot from the hip sometimes. But when we go on vacation or do things like that, the I'm the spreadsheet person. I have a Google Doc that has every single thing in there, every link to every confirmation, everything. So I'm definitely mixed. And it's almost always you're either one or the other, right? There's not like anything like in between, I don't think. Let's talk about your Project Zero. Just for the listeners out there, Project Zero is that first project where you figure out how to be a project manager. Maybe there's some successes, some of the failures, lessons learned. I'd love to hear about what that was for you, Jordyn.
Sure. Well, I'd love to tell you about a project. I'll start maybe with one that went well and one that didn't go so well.
Right?
So I'll tell you about a project I initiated and led where we transitioned from a manual claims documentation process to a more automated one. And so the goal was to plan and implement this transition. And the way we did that was tying paperwork that had to be completed to the claim that was going to be submitted to Medicaid. And that way, that claim would be auto-generated because the paperwork was uploaded. And so this eliminated 3,500 manually written claims annually to zero. And my job was to coordinate between our third-party software vendor and then the non-technical staff in the department. And we needed to make sure that these technical dependencies met these complex Medicaid documentation and billing requirements. So I acted as the translator between the developers and case managers and nurses and their operational needs. And so in the end, There was way less time spent on admin work, less training needed for onboarding new staff or training whenever guidelines changed, because we could just make those changes in the background now. There were fewer billing errors that needed to be corrected each month, increased staff satisfaction. They're not having to do this thing that is not actually what they want to be doing. And then, this saved time, money, and added some room for improved quality of care. So that was a project where I got to implement a lot of the things that I had seen other project managers do and do it my way. And so that was a really great experience.
Interesting. I know you mentioned that you could see how other project managers were doing it. Did you have a really great mentor on that project, or were you just like Googling, maybe asking a few questions here and there?
Yeah, I didn't have a dedicated mentor. I had just been, I guess, observing what project managers from other teams were doing and then taking pieces of that to fit into what was relevant to my project. So I can give you an example. One thing that I did was set up a collaboration group of end users who I met with to run project plans by and get feedback from. And then I brought what I heard to our engineers. And so I facilitated these conversations and, involving these end users as much as I did really helped drive that adoption to the end. So, we planned for how to introduce these changes to the team. So first, a general announcement during a department meeting ahead of time, just to let them know this change is coming. And then notifications via email when it got closer. And then a large group training session, and then smaller ones within those teams, and, open invitations to ask for one-on-one time if needed. And so, the collab group really got to be the face of the improvement for their colleagues. And so with that and lots of planning, the rollout went super smoothly. And I've applied that to my projects whenever possible since then. So that's something that I had seen in the past and then mirrored for my own project.
Awesome. That's so great. Now let's hear about the nightmare. Let's hear about the bad project.
Yeah. So this is at a different organization, and my team was approved to integrate our case management referral system workflow into an existing software that the company was using for other programs. And because I'd been working in this case management program before at a prior organization, I got a strong feeling that the existing software wasn't going to be able to handle our program's really specific complexities.
Mhm.
So I recommended some alternatives for building a custom system, but of course we had to go with the existing, less expensive tool. And so during discovery, when my team and I were asking the technical team if they'd be able to implement specific features without overcomplicating workflows, we were told yes, again and again. And it seemed like maybe our needs can be met. That'd be great. I'd rather be wrong. But as implementation progressed, it became increasingly obvious that many critical elements were not possible, and solutions that the team was implementing turned out to be more like Band-Aids, and there were a lot of showstoppers that came up that didn't seem to be surmountable anymore. So what I learned from this is to be wary if you feel like you're being told yes too easily. And it's important to really investigate whether these proposed solutions are actually viable. Even if they're being proposed by an SME, you need to make sure that it's actually going to work. And so push back a little bit. That's part of the project manager's job. So
Yeah. Some of the advice I got when I was earlier on is, just be just super curious, right? Be like, coming from a place of curiosity. Earlier in your career, you get nervous about sounding dumb, right? You don't you don't belong in the room. But honestly, I feel like that's almost a PM's job, and you don't sound dumb when you ask things from a place of curiosity, right? So to your point, you knew something was up, something didn't sound right. And if you had the experience, if that came up again today, you'd be like, all right, yeah, this doesn't feel right. Why do you think this is possible? And then that'll get other people in the room also saying, oh, wow, yeah, this does sound odd, right? Love that outtake. Were you able to make any adjustments while you were there at all? Did you start to make any inroads with pushing back in any way with them, or were they too heels in on it?
Yeah. So to start, what I did is I escalated this to my manager and we started gathering specific examples of missed functionality and the technical limitations so we could present it to the leadership on the technical side and discuss whether this project is actually feasible anymore. Before a final decision could be made, the project was put on pause because the company needed to redirect resources because of a change in company priorities. And I'm not at the company anymore, but as far as I know, there isn't going to be movement on that project anymore. So we'll see
Yeah.
what that means. Yeah.
Yeah, honestly, like project failure, ideally, like projects not starting that are going to fail, or that's the best time to fail in a project is like right at the beginning. I don't even call it a failure. I just call it a good decision. But even halfway through, sometimes you do have to just throw things away if they aren't feasible. You want to learn that early in the process, right? And that's a lesson that you learn there, but it's not always
Right.
possible.
Cost fallacy.
That's right. That's right. Don't we all believe in that? Cool. Let's talk a little bit about the advice that you've gathered over the past decade or so. What do you think the number one skill is that project managers need and why?
Hmm. Well, I'll bring it back to embracing that non-expert status that we were talking about. You don't need a computer science degree to manage developers. You just need to be a great listener and a relentless question asker. Stay curious. So that is one piece of advice. And then for someone maybe earlier on in their careers, especially, I'd say within reason, don't wait for permission. So if you see that a process is broken, look for a tool to either fix it yourself or propose a project to have it get fixed. Because showing some initiative in that way is a good way to earn a seat at the table and get noticed in your company. And maybe you'll have a vacancy in the department or company one day and someone will think of you because of
I
that.
love that advice. It's so good. Yeah, I always say I like whether it's an entrepreneur that talks about how do you grow your company to something that, you're proud of and you're targeting, or whether it's someone earlier in their career, doesn't have to be a project manager, it can just be anyone, right? Like you always want to it's like you're that next level up. You don't want to act like you're in the big leagues when you're still in little league, right? Look at what that next level is and try to fill that role, even if it's not your responsibility. And then eventually you'll get that, you'll get the role. And so I love that advice, Jordan. And that little piece of that little nugget of being curious, I don't think anyone's ever mentioned that. And I think it's such an important part of project management is being the expert and not being the
Definitely.
expert.
Yeah. I mean, giving
Love that.
yourself permission to not be the expert allows you to ask those dumb questions that end up revealing hidden project risks or whatnot. And, that could be what saved the day. So,
That's right. That's right. That is always what saves the day.
mhm.
The stuff that people weren't thinking of. Let's talk AI for a second. So Jordan, like, how do you think AI is going to impact how project management works over the next couple of years?
Sure. Well, I can tell you how it's already impacted my work now and what I think that means for the future. So I do my best to keep up with the latest in AI in relation to my work and life. So I highly recommend the Superhuman Zane newsletter and the AI Daily Brief podcast. And you don't need to read or listen to every release, but even keeping up with it a couple of times a week has kept me super informed. And so Superhuman Zane's newsletter includes an example of a helpful prompt. And whenever one feels relevant to me, I save it in a Google Doc so I can reference it later. Jeff Sue, he's a great resource for all sorts of work productivity. And his content also includes ways to store and organize helpful prompts in Notion. So some of my favorite prompts are ones that have helped me poke holes in my thinking. I wanted to tell me what are my blind spots, what risks haven't I mentioned, what motivation my customer might have that I haven't addressed. Or another one will help me translate technical documents or long articles into plain English. So it'll pull out any notable trends and point out the key takeaways so I don't have to decipher this thing that's in a language that I don't understand. And especially if I don't need to know the ins and outs of it. So really great for like publications. So this really helped me get a deeper understanding of things that I wouldn't otherwise be able to easily grasp without a lot of time. And in terms of the future, I think AI is going to be a huge part of it for project managers. People are afraid of it taking work away, but I always think that there's going to be a human element that's necessary for it, especially, there's always going to be a customer who's a human paying for whatever work needs to be done. And they're going to need another human on the other end to, facilitate that work. So I'm excited to see what happens.
Yeah. Yeah. Same. Thanks for sharing those resources. Definitely got a couple that I'm going to add to my list for sure. And I think big takeaway that I want to amplify is just creating this prompt library. Like whether it's your personal prompt library or a company prompt library, it is so valuable to have this arsenal of awesome prompts to do specific things. And if you organize them in a good way, like they're really easy to grab. In fact, like for us, like we even have like agents that can go and like grab the prompts for us based on how they're cataloged and stuff. And that's huge. And even on a personal level, people think it's overwhelming to be able to keep track of it. But it's really not. You did it in a Google Doc, right? Love that, Jordyn. Listening to all these podcasts and reading the newsletters, you have to hear some cool AI use cases. What's the coolest application that you've seen of AI out there?
Sure. I'll tell you an example that actually someone in my network just told me about at his company. So he also works in Medicaid programs and with like quality, performance related payments. And a lot of this reporting that comes from state programs is very fragmented. Data elements are not always standard, especially if you're pulling data from multiple different reports. And so his company is using AI to pull all of those data elements together and create dashboards that then tell a larger story out of it. And so it sounds maybe simple, but it's really critical. And I've been at companies where we had the same problem and we just had to essentially reverse engineer these reports in our own ways because you also don't know exactly how the metrics are being calculated. And so you have to make your best guesses. And so to have AI be able to do that, obviously with a human eye looking it over, is a lot faster and really mission critical for operations, honestly, and driving decisions. You need to know what the whole story is. So being able to pull it all together in one place is really cool.
Yeah, it's so interesting. That reminds me, like I'm going to HIMSS in a couple of weeks, and there's so many sessions about what comes first. So we spent all the like awesome legislation got passed. Cures Act requires FHIR integration, like standardization of integration, like the structure of messages that go back and forth. Like it was a huge change, like life-changing change if we could actually get people to do it. And I think we're getting there. But then AI comes out, right? And a couple of years, like in the middle of the implementation of it, and it's like, AI is really good at taking this like structured, unstructured, whatever data, compiling it, and then sending it over to another place. Like, what comes first, FHIR or the FHIR standards or AI? They're both great, and so there's a lot of conversations around that. So I'm very excited to hear stories like what you just described, Jordyn, because it's going to really change the healthcare space for sure. Do you have any other advice for someone that is maybe early in their career as a PM, or maybe someone that's just coming straight out of college that is, let's call it PM curious, right? What would that advice be?
Yeah, I would suggest to them to speak with project managers who've been in the role for a few years and ask them about what they do and tell them about your own experience and see if they can help you tie that past experience directly to what project managers do. Find those transferable skills because there's probably a lot that you've done, if you've been a student that directly relates. You've managed big projects, schedules, maybe you've had leadership experience on an athletic team or whatnot. And you can figure out, how should I frame this in an interview? How do I market myself? Like, oh, maybe you'll get some more confidence and realize that this is much more applicable than you thought. So learn more about it and find someone who can help you connect those dots.
I love that concept because no one's born a project manager. So it's about the compilation of all these different skills. Maybe you're naturally organized and maybe you're a shoo-in to be a project manager. But I love, Jordyn, where you just say, hey, talk to someone that's done it, right? And then they can help you map that. Love that advice. Cool. I think that's it. We had some really good content here, Jordyn. I really appreciate the time here. How do people get in contact with you? What's the best way?
I would love if you would connect with me on LinkedIn, or for business inquiries, you can email me at hello@jordynseri.com. That's HELLO@JORDYNS, as in Sam, ERI.com. And I should note that I'm currently accepting new clients, so I would love to hear from you.
Awesome. Thank you so much, Jordyn. Awesome insights, really cool stories. You gave us two opposite ends of the spectrum, good and challenging projects, lots to think about and learn from, and some really great AI resources. So thank you for that. And thank you to all of you who joined us on Project Zero this week. Be sure to subscribe to Project Zero wherever you get your podcasts, and we will catch you next time with another great project leader story.